Welcome to Impact Leaders with Magda Petryniak. My today's guest speaker is Tomasz Rudolf, co-founder of Doctor.One, a company humanizing healthcare, connecting doctors and patients beyond visits. Tomek, welcome to the studio.
Thanks for having me.
It's such a pleasure. We know each other for quite a long time. I know you as a very creative and successful entrepreneur. I know you have kickstarted many initiatives in social and business area, including a venture studio, The Heart, that it's helping to build businesses and products, connecting products, companies with international corporations, also Innovatica, and a social project, the K.I.D.S, which is the Hospital Innovators Club. Is just naming a few because you're very, very productive and creative. It sounds like your second name is innovation. So tell me, what motivates you to start this new venture, Doctor.One?
Well, I think mother of invention is the need, and I saw the need through a personal story. Just working so much with digital and innovation and transformation with across industries, from fintech to retail. I had experience of transforming experiences of different users. And then I went to the Children's Hospital where I was a patient in the 80s. And I went there with my son 30 years later. And obviously there was lots of brand new equipment, but the processes were still analog. It was, in some cases, a digital desert. The patients were registered in a paper notebook. There were queues and so on. And I actually, through the whole experience, I felt so humble and so powerless and so lost throughout those days that I thought, well, maybe there is something that we can do. And that's how my journey actually with helping to humanize healthcare and transform healthcare has started, by setting up the foundation. There I met Maciek, who is my co-founder. He has lots of experience in healthcare as innovation head of the biggest private provider. And we started discussing the future of healthcare and what frustrates us. He also, his wife is a doctor. So we were discussing it both from the provider side, the doctors that are also frustrated with some inefficiency of the system, and for the patient side, so the loneliness of the patients that are sometimes left alone with their chronic disease. They have a visit maybe in a month or two, but otherwise than staying and looking in Google, they need help and they cannot find it themselves. So we decided to just fully focus all our experiences and our time to really transform it.
Yeah, so I hear there is a personal story behind it. You as a child who visited the hospital, then you bringing your own son, but also a ton of empathy towards doctors and the whole system. Healthcare is such a big area, but if you were to kind of describe what's wrong with healthcare, like what's not working in this patient-doctor relationship?
Well, I think in general, when you look, the systems have both financial challenges right now with medical challenges or population health challenges. We have obesity epidemic and lots of different challenges to really be able to afford the high quality service and give access people to healthcare. But in general, on a system level, on how it's organized, this is a very fragmented visit-based system where most of the systems are just based on the paradigm of a visit. Not we pay for visits, we book visits, and most of healthcare is done through visits, besides some procedures in the hospital. And that's how the paradigm is organized. And what we pay, we get. So if we would like to have care that's continuous, that's not that fragmented, that's not that reactive, waiting for the patient to book a visit to really get a service, but rather than that, to really monitor the patients, control how their illness is developing or how they're getting better, and paying for results, for better outcomes, we need to transform this. And our dream is for healthcare that's continuous, that's leveraging also continuous patient monitoring devices, and where the doctor-patient relationship is also enabled through the right business model, the right regulations and reimbursement.
As you mentioned, there are different systems across countries, and even in one country, there are private hospitals, public hospitals. So what was your approach to transforming this relationship between the patient and doctor?
We started Doctor first. Our name is Doctor.One, so maybe that's natural. But we decided that you cannot change the system by not looking at the heavy users of the system. The heavy users are the doctors and the nurses and the healthcare professionals. They are sometimes overlooked because we say the system has to be patient-centric. It's more administration-centric because the administration sets the rules, the reimbursements, the procedures, whatever, oftentimes. But the doctors were often overlooked. Their needs were overlooked. Their professional judgment was somehow hindered by the processes, what they can do, by their calendar, by the time they have per patient, by the bureaucracy they have. And we just talked to the doctors and asked them, how would you like to support your patients beyond the visits? Because we knew there is some potential, just like we work on Slack or Teams in business, to just connect and collaborate across weeks and months of care, especially for chronic diseases. And those doctors told us that they just give their private phone, they give their email. They sometimes have little control over what happens with their private contact, and then they get messages, sometimes tens of them or hundreds even per week. In the evenings, they have no free time. They're like an ER, more or less. They're always on call. They cannot relax, which leads obviously to burnout. If you have no feeling that you are really driving this, that you're a leader of patient, but you're just a recipient of visits, and you don't see your patient anymore, you don't know what happened, if you actually helped or not. Plus, you feel you need to do voluntary work after hours that nobody really appreciates. We decided that this has to be changed, doctor first. So we designed it with doctors. We, for example, designed something that we call a virtual round in our medical communicator that is something like a medical WhatsApp, if you will, designed to support the doctor in providing support to their patient. We have a virtual round where the doctor just checks in once a day, answers all messages. They can call the patients, but the patient cannot call them to keep the balance of the relationship actually healthy. And all those tiny things that were designed with doctors to make their life of caring for patients easier was our paradigm. Now we're going beyond that and integrating it into the healthcare system. But we said we need to start with the doctors, and no change in the system actually will happen as we see it by thinking, okay, it's AI or it's just robots and administrators doing this. I guess that rightly so, doctors have still so huge influence on what gets done on a daily basis in healthcare that we cannot overlook them and not listen to them enough. Yeah.
I can sense that you really put doctors in the center, this doctor-centric model in everything you say. It translates how much you care for doctors' needs. You talk to doctors, but there's also your own need and your own feeling that it's so important to address this issue. However, when you start a business, and Doctor.One is a business initiative, just a feeling, understanding, and empathy is not enough. There must be a business idea behind it. Yeah. So how did you know from the very beginning that there is a business potential in this idea, in this need?
Well, I think 85% of money in healthcare is spent on chronic diseases, where one single visit with a random doctor cannot solve the problem. It cannot prevent it, it cannot solve it. And we know that just allowing patients to book a random visit with a random doctor is inefficient for the system, for the payer, for the patient, if the patient pays on private markets. And it's not efficient for the doctor because even for a 1-minute question, the patient books 15 minutes of their time. And those doctors are so busy, they even feel it's inefficient. With the huge boom of telemedicine that was acute and just one-off visits, we knew there is potential to do not just a worse visit online, but to do a whole new way of doing and managing patients, especially with chronic diseases, better by connecting those doctors and patients online. Obviously, we had to find the right business model. We have two right now. One is for the private market, where any doctor might just provide care on a subscription basis. So you might have, just like you have your personal trainer that you pay every month, you might have your private doctor and communicate with them as much as you want about your chronic disease. That was our initial model because that was the easiest to start. Now we are integrating that into the healthcare systems, working with providers to make this a standard of care for any chronic patients, let's say with obesity or multiple sclerosis or any other disease that requires constant monitoring of the patient.
Mm-hmm. So you're describing that you started with subscription-based model and now you're testing or you're implementing the B2B model. Tomek, we know that entering a new market, like this is a healthcare market, is very often money consuming and time consuming. What were your early experiences with this project? How did the market react? How did doctors react to this idea and patients?
Well, firstly, we were lucky to get support immediately from investors that they believed healthcare. We were starting 3 years ago with the pandemic around us, and everybody was looking at how we can make healthcare, especially remote care, at-home care, more efficient. And the doctors and patients were just waking up to the potential of the remote care. So our investors were actually believing in our story and in our investment story. So that helped a lot, and that gave us some bandwidth to actually experiment and build a product. It's not easy to build a healthcare product because of all the regulations, all the compliance, all the security. Regulations. We had to actually open a virtual clinic to manage all the data so that the patient-doctor communication is secure in our hands. And obviously then the biggest journey was trying to find the best model to understand how doctors will use it, where they see the best application. We started with tens of doctors, then we went to hundreds and then to thousands. And we were mostly looking at how they naturally see it applied in their daily life. We initially gave them the tool and told them, okay, we assume it's good for chronic patients, but we're not doctors ourselves. So you tell us. And we observed the patterns based on data, where they apply it. We listened to them and we asked them, which one disease do you think is best applied? Which disease would you apply it? Just like a drug that you apply for a certain disease. And then we slowly moved to one disease at a time, scaling. We said, well, it will never be applied in the whole healthcare system at once. That would be boiling the ocean. You need to take a focused approach, just slicing a salami, and then pick one disease where it's an invincible, great solution, and then apply it there. Especially that's how doctors think. They have specializations. They are very focused on diseases. They work with pharma companies to improve care for certain groups of patients, and that shift to one disease at a time, implementation and scaling was very helpful in driving adoption.
Yeah, is there one particular story from this period that you are very proud of, the implementation of or use of Doctor.One process?
Well, there have been many where we had almost tears in our eyes when we learned from a patient that actually the doctor that they were in contact with really saved their life, because how close they were, and the doctor could monitor or could find some strange messages and called an ambulance for that patient and send that patient to the hospital, preventing probable death. So we had lots of stories from patients. We also had lots of impact stories from doctors that tell us how it improved their life and their quality of life and rest and work-life balance. But I think the recent story that really is so impactful in our team is how we looked at in one use case of patients with multiple sclerosis, which is a disease that happens mostly women in their 20s or 30s, and they have a life-changing diagnosis. And they still would like to have children and work and whatever, but their life changes. And from now on, every 3 months, they need to go to the hospital, they need to apply those drugs and whatever. And through partnership with a pharma company, we actually implemented it in 5 hospitals, gave that tool for every patient that starts treatment. They are not left alone and say, okay, come back in 3 months anymore, because that's how the system is organized. They get direct daily contact with the doctor that knows them. It's not a call center, it's not a bot, it's actually the human being that cares for you. And we saw how amazingly that has been applied. We saw that over 3/4 were using it every month. And when we asked, do this survey after 2 months, how happy both sides were with this, obviously, it was clear for us that patients would appreciate such a contact if they didn't have it, and 100% of them said they love it. It should be applied throughout for everyone. But also the doctors said that it actually improves their life, and it gives them better control of the patient. It actually opens up the patients to ask maybe questions they wouldn't normally ask in a visit, because they didn't have time or because they didn't have this problem. But right now, from a very fragmented point-based system of care where you say have like 4 dots in a line of care every year, you have sometimes for one patient it was 65 messages that patient, extreme user, exchanged with their doctor over 6 months. Wow. So you see how close that care becomes and how humanized. You really have a human companion on this journey, which I guess we are a lonely society as humans right now, but if you're really sick and if you have a life-changing diagnosis, you're even lonelier. And we believe that's something we would like to change, so that nobody is left alone with their disease.
Wow, this is a very compelling story, and I do believe in storytelling so much. I know it's one of the building blocks of building trust and building credibility. If I hear such a story, I'm more willing to give it a shot. If I'm a doctor or I'm in the system, I'm like, okay, I want to try it myself. What were the other building blocks of building trust between Doctor.One and doctors and the system?
Well, obviously we started with some doctors that we knew, and then we actually tested tens of different things of ways to reach doctors, with online, with ads, with videos, with content. But actually what we learned very quickly is that there is no substitute for actual conversations and human-to-human contact. So we spent, I guess, time at 50 conferences, medical conferences last year, spending almost every weekend somewhere talking just to hundreds of doctors. And we learned to explain what we do in 1 minute and then getting them to download the app and start working with patients within minutes. So I think, especially early on, if you're building a new solution, you cannot do things that just scale and think, okay, I'll spend money on ads, whatever. There is no substitute for actually hearing your doctors, seeing their phones, seeing even the size of their fonts, because many of them are like me, over 40. So our UX team, for example, found it super insightful to see and talk to those doctors. And I guess our whole team was there at those events, talking about product people, testers, developers, everybody, to be in contact with our doctors. And that was very important to build trust with doctors. For patients, they aren't finding Doctor.One online. They just get it from the doctor they trust during their visit. So we had no challenge there, and the adoption was amazing. In the system now, we are seeing that obviously working with partners that have patients, that with providers, with pharma companies, they have the trust, they have the relationships, they have the experience. So joining forces with them to transform care paths for different types of patients is our next frontier. We're joining forces. We cannot change healthcare alone.
I hear you. I hear about the power of every single conversation from the very beginning. And working with some startups, I realize that many focus on mastering the product and they keep developing the product instead of going out there and meeting customers. You did the first thing, which gave you probably a lot of feedback, how to improve that experience and the relationship. There is a question like, instant question, why wouldn't a hospital like Doctor.One in what they do, in managing the relationship with patients? And probably some questions cross my mind. What were the biggest challenges for you at the beginning, selling, spreading Doctor.One system?
I guess every system is designed to produce results. It produces, it delivers. And this system that we have is mostly manufacturing visits. and it's a factory line. Some doctors even told us they feel like working in a supermarket, asking to be moving patients faster. There's lots of time pressure on this. It's very hard to fit in such a system. So you cannot also add Doctor.One super easily because doctors are so busy, they need to take something away in order to switch to something else. And I think that's a big problem with many startups, that they assume that there is a tabula rasa, an empty stage, and they'll be just adding something cool. For most of those doctors and patients, we are replacing a care path that existed with a care path that is maybe better, but new for them and unproven. So doctors need clinical proof. Okay, where has it been applied? What research articles have been done about their impact? Is it safe? And so on. So lots of questions. And again, we learned that it's very hard to prove the value of Doctor.One for all types of patients, for all types of doctors, both those working in hospitals and those working in a pediatrician in a small city, and in a internal medicine doctor in a big private clinic, and a hospital doctor working on multiple sclerosis. We cannot gather that proof at the same time. So we really focus on building that trust, one use case at a time, and this really helped us unlock credibility and show results on different types of patients. So it also allows you to build empathy for the users, both for this type of doctor and the patient and the care path they're on. And really assisting them on this path. So that was, I guess, our key learning, that even though many startups, I guess, feel that if they go generic, they'll have broader application. My advice would be to really focus on the use case where your solution is most compelling, where people would just love your solution, and then start scaling from that, rather than trying to provide a solution for everyone.
You mentioned that you got investor from very, very early stage of the idea. Investor bought your idea, believed in you. We know that investors believe not just in the idea, in the business model, but also in the team, in founders, co-founders, and the whole team. What is the role of investor in developing Doctor.One?
It's way more than just money. I think obviously having someone believing in you on this journey is very, very valuable, especially if that's an investor that's been there for decades and has seen many companies struggling at different stages, having mistakes, like premature scaling, hiring too fast or whatever. So having someone that has selected you and done a huge due diligence. Actually, Atlantic Labs, which was our investor from Berlin, they spent like a week talking to like 10 of our doctors, the whole team, all are former co-founders from past companies I built and Maciek's employers. And when they really said, we know everything, Daniel, who's leading our investment, I did due diligence on him as well. And his portfolio company said, he knows the business so well that he could, if I was gone, he could manage it. So having someone like that, knowing every detail of our business, supporting us and having our back on this journey is super important, especially that this is a painful journey. Maciek, my co-founder, is a multiple Ironman, and he jokes that Ironman is way easier than building a startup because it's just nine hours of pain, and building a startup might be 9 years maybe, so or more. And I think having someone that has your back no matter what, that asks sometimes challenging questions, obviously helps you with further investment, with tough decisions, sometimes challenges you to, I don't know, maybe fire someone if necessary, or to pivot or to find a better solution. I think that's really making you avoid the loneliness in this process. It's a very tough journey, especially in healthcare. I mean, I've built companies before. I've never seen anything that complex, and mostly through the regulation, but also to the fact that those aren't markets that are easily scalable internationally. Each market has some specificity, different payers. If you are building a game, those gamers might be similar all around the world. If you're building a B2B business, there might be maybe 2-3 different stakeholders within the business that affect the decision to buy your product. But within healthcare, you have providers, payers, patients, and so on, and in very different systems. So it's very hard to build something that will be applicable for all of them, for all markets. Yeah, you need to choose. It's a matrix of therapeutic areas, payers, providers, countries. Very, very complex spaghetti of decisions. Yeah,
I hear you. And you're only 2 years into
3 years now.
3 years now into building this business. Have you pivoted already, or have you kind of
we've
disrupted?
definitely made the switches and changes in our approach. We've tested tens of different things, both in getting the doctors to adopt it, getting patients to adopt it, the product itself. We've rebuilt it based on the learnings from first years, and now we are scaling it also through B2B partnerships. So it's totally changing business. It's every few months. It's a new evolution of it, and probably it will keep evolving over the next years. But the vision remains the same. Just to humanize healthcare and to have both for the doctor a more human solution, and for the patient a more closer contact to someone that knows them.
I get it. You started the business in Poland. Is your vision to make it global? What is your strategy?
Partnerships with global providers and global pharma companies is a way now that's opening up scaling opportunities. Obviously, there are many types of healthcare businesses. Some of them sell to patients directly. Some of them sell to insurers. Some to doctors. And we believe we need to find in this market some allies. And finding those allies can unlock you new markets, make the expansion way less risky, and that's we don't want to do it alone. We just want to join forces with those guys that have networks of doctors, have credibility, and can partner with us on changing a therapeutic area, not just on one market but throughout their portfolio.
You keep emphasizing the importance of the team and partnership, and that you don't want to do it alone. And actually, you cannot revolutionize healthcare alone. Can you tell a bit about how do you build a team in this Doctor.One company? Who are you looking for? Who are the talents that you invest in that bring this vision alive?
Well, I've always been a believer in Marcus Buckingham's strength-based approach, or Gallup, or whatever, just to understanding what people are great at, and trying to find the best way to apply their talents at their stage right now for the challenges that we have right now. So obviously there is some common denominator in our team, and almost all of those people that we have right now, we actually started working together in the pro bono work in the foundation before we started working in the business. So they were battle tested in being value driven and actually caring and volunteering to do change in healthcare. So we knew we had similar values, and at the same time we tried to pick really A-type players for the sports team, where we need different types, different roles. But also kept switching them as we changed, as we pivoted, as we did some changes in the model. We revisited the structure and we changed, okay, from today on, you're moving to this front now, and we're experimenting if this will actually work. I'm a big believer that you cannot build organizations just based on your ego and on your talent only. You need to build them to be bigger than yourself. And I have actually the most joy to see and witness organizations that I built, but then found a better CEO or to continue or make it self-sustaining, that they work no matter who leads them. Yeah, I have one that I set up 25 years ago that still operates, and each year a new board takes it over. It's a student organization that I set up with my friends when I was studying, and to see how that legacy moves on and that organization is strong enough to survive any succession. I believe that's what I would obviously love to see Doctor.One going for decades or hundreds of years. And I guess that's something that I believe you need to understand what the organization needs and build a team that actually can support that.
Doctor.One is not, I know it because I know you for quite a long time. Doctor.One is not the first business project that you built around social idea, social needs, the impact. Yeah. There were many before. I think across all your projects, there was this, there was this element of making an impact. And I wonder, how did it start in your life? Where did it come from? Was it your upbringing, your mentors? How did you define that you want to do business that has bigger impact than just money, making money? Do you remember the moment in your life, maybe early life, that you already knew, okay, I will invest my energy, my time, my talent, but I want to do something meaningful?
Well, apparently, as far as I remember, I told my parents it was still communism that I will have my own business when I was 4. It was at that time supposed to be a restaurant, but because that was the only business I could understand,
you were 4.
I was 4. Okay. So I was telling them. But then very early on, I became a scout, Sea Scout actually, and the idea of serving others and servant leadership was very close to my heart. That you need to do something that benefits others, and so I think that's something that stays in you throughout your life. It's hard to get the scout out of you. But then I actually saw that it brings me most joy if I see that what I do is not just for making me rich, which obviously when we are dead, all our wealth goes into the box, no matter how rich we become. And I think having the joy that your work is meaningful for others is for me a driving force. So I'd love to build businesses that actually make sense.
So you mentioned that you started very early. You were a scout, Sea Scout. Did you have people around you who empowered you in this philosophy, in this thinking? Maybe mentors, people who inspired you, who were like patting you and saying, okay, this is great, do it.
Definitely. I mean, I've been lucky to have lots of those. And I think it's mostly because if you're working on a mission that's bigger than you, it has gravity to attract anyone. And I very quickly learned that if your vision is big enough, that gravity grows. and it's okay even to, if you read a book of a world-class author, and if you approach them with your idea, they'll support you. And actually how I started when I was 20-something, I started working on innovation. And I wrote to almost all authors of books on innovation. They asked me to join their club. I was going to travel, started working with them, and many of them became my mentors on that journey, sharing not just tips, but also collaborations that we could join forces with. And something that I'm trying to bring to my kids, just if they have a dream, that they should just not think, okay, it's just a dream, but just to try it. Yeah, my daughter was watching MasterChef and she really loved it. We cooked together since she was a kid. So yeah, we said, yeah, just try it. And we went to an audition, and then she was in the final. So
congratulations. Okay.
And the same was with soccer. She just went, and now she's playing on one of the best teams in the country. So I'd love them to just try out and just not hide with their dreams, waiting for them to happen, but just try it. Not all of them will work. But if you try it, it can work actually.
That's very empowering. What you're saying. What other values or skills are you trying to teach your kids that you found were important in your life, and now you want your kids to understand it, to feel it, to experience?
Well, one thing that I didn't have when I was growing up was really team sports. I envied those that were great at sports, and I never did sports. I was the shortest, the skinniest kid in my class, and nobody picked me for the soccer team. And I wanted my kids not to have the frustration with that. So they started actually both playing professionally soccer since they were 5 or 6 years old, and they both play together. And I believe the discipline that teaches you, the winning and losing, the hard work, healthy lifestyle, and so on, it's great. And also trying to understand where you want to fit, understanding your strengths. Are you a goalkeeper? Are you a defender? Whatever. I think in general, if we want to have a healthier society that's not just on their phones, we need to invest way more into having both our girls and boys way more active and more, just like they find their passion in life, they should find their passion also in sports and join a club of whatever, whether they play chess or swim or whatever. I think that helps a lot and shape your character.
One more personal question. There are many people who know you for many years. People who met you 15 years ago, like I did, probably know a person who is very outgoing, creative, entrepreneur, and you are. But what are things we don't know about Tomasz Rudolf? What have you changed in your life? What lessons did you take that changed something in you that maybe we don't know about you now?
I think everybody has those both weak points and struggles. And I think especially now with so many people struggling with mental health, I guess it's good to know that if you're struggling, you don't have to do it alone. And I've had my struggles as well and work with a therapist to really trying to understand why are certain patterns happening. So I think it's important to invest in your well-being and in your personal development, but also if you see any struggles, to discuss it with a professional. I think that's something that maybe isn't that obvious, especially if you're officially an extrovert or outgoing, which many people also with mental health problems have. I think we all struggle and we are all broken from time to time from family life or work life or any other maybe traumas from the beginning of our lives. So I think I've learned to care for myself and for my family and invest in this. I think we need to take time. I think recent change since the pandemic was just investing in my sports life that helped transform me mentally and physically and get me healthy again. I guess when I started to understand what's the impact of fitness and exercise on both our mental and physical well-being and health, I really changed a lot in my life.
Thank you so much for sharing that. I think there is this perception that when we see a person that is so successful, always positive, optimistic, like vibrating with all these ideas, we think, okay, that person has this enormous strength and is fearless and has no doubts. So I think it's very enlightening when you're saying that you also encountered this darker moment in your life and that you decided to ask for help. If you could share, was there a specific event or specific moment then you realized, okay, I don't want to be alone in this? Was there something that triggered that, or that was a gradual thought in you that, okay, I don't want to be alone and I don't want to be always strong?
Yeah. Well, I think it's not a one event. It was a process and some patterns that I was trying to understand, and obviously reading lots of books about healthcare. I found some things that I just found disturbing, and I wanted to discuss it with a professional. So I think it's important to have that self-awareness, especially as a leader. We are very often alone on the top, and people expect us to have all the answers. And there's extreme pressure to be always positive and leading the team. And as a startup leader, you have that pressure maybe doubled because your organization has a life sentence. And unless you really find your business model, you might have funding maybe for a couple of months or a year or two. But your idea might die, your business might die, and obviously that impacts both your life and your ego and the team, people you're working with. So I think it's important not to do it alone. I really cherish from the Leadership Academy for Poland also a group of that we call NEST, a group of peers that work in different areas, and they are my sounding board also to discuss challenges and help each other on how they would solve this problem, to see them from a perspective, from a balcony, because we're often on the dance floor in emotions, and we cannot really distance ourselves from what's happening. But really, we need this safe haven where we can retreat, where there is someone else that has perspective that we can discuss it with and not feel alone in this.
Thank you so much. Yeah, the importance of having a community, having a safe nest that really helps you in your struggle is so important. Tomek, now you are in the healthcare area and you are yourself an ambassador of healthy lifestyle. If you were to give, I don't know, 3 ideas, 3 clues, recommendations for leaders to stay healthy, both physical, mental, emotional, what works for you the best? What would you recommend?
The first thing for me was to get a dog, because then you need to make breaks 3-4 times a year during the day and then walk. And that is a brain-stilling time for me when not brainstorming, sometimes brainstorming, but mostly brain-stilling, where I go and relax. So that was the starting point. Then obviously joining a gym or any other club, or just having a partner that you run with, or any, I think, so exercise is, I guess, extremely important. Then diet. I stopped eating meat about 4 years ago, and that helped me as well to still feel better. Having a passion that you can just do with friends together. I think relationships are super important for mental well-being, especially as we age. So not feeling alone in this is important to relieve stress. So I think diet, exercise, and obviously the last, sleep. I sleep like a baby after hours. I wake up early with my dog now, wanting to go out. But going to bed early enough is important as well.
I love the idea of brain stealing, because too much brainstorming, too much thinking, overthinking is really burning our energy and over worrying about many things. So I'm stealing that from you, brain stealing.
Brain stealing.
I'm stealing the brain stealing idea from you. Thank you.
It's actually from Professor Leif Edvinsson, a guru on intellectual capital.
Yeah. We started with the idea of transforming healthcare, and you are about humanizing. I just want to ask for your reflection on what's going to be the role of AI on transforming or changing the healthcare system, especially in this area of relationship between the doctor and the patient.
Well,
Is it
I believe
and just,
it will
is it
be.
a threat, or is it for your business model? Or
No, not at all. I mean, we believe the future of healthcare is obviously AI in some elements, but it's also HI, as we call the human intimacy or the human interaction. And there is place, obviously, to reduce all the dumb work or hated work for doctors of the bureaucracy, the typing, whatever, and just focusing on the person in front of you. And technology can be a great tool in this, and in proactive follow-ups, in analyzing data, so that you don't need to wait a month for the results of your scan. Yeah, so there is a huge place for technology. The question is that everything? Yeah, we don't want to be cured by robots and bots and doctors working like robots. We want another human being, the magic touch of a doctor that is with us in any disease. I guess none of us would like to hear from a bot that we have cancer or be asked just how are you doing today. We need that human being, just like Maciek keeps saying, my co-founder, on planes. Most of those planes can land themselves, but we still have those captains. And we see there is huge space for healthcare professionals, not just doctors, but nurses, educators, and so on, that will be there on the other side, the human side, and will be assisting the patients throughout their journey. They will have more time to focus on the human rather than on procedures and bureaucracy, thanks to AI. But we believe there is space for humans in care. Because
so you call it the human
intimacy.
Intimacy.
Yeah.
That's very
someone that really knows you. Yeah, because there is some magic in going from door to door in a hospital and just repeating your whole story. You feel devaluated, you feel nobody knows you, you feel anonymous, yeah? Versus talking to a doctor or getting a message on Doctor.One the day after you got a new drug. How are you feeling? Are you feeling better? It really melts our hearts when you hear the story, but this is the human element in action. Yeah.
It is true. I think it's one of the most basic human needs to be seen, to be heard by another human being, not just by a robot saying, okay, Magda, welcome to your favorite hotel. Yeah, it's not the same. So it sounds like your model with AI will be in collaboration. It's not either this or that. But are you working on some AI models already?
Well, we are definitely building tools that make life easier for doctors. So we can imagine, obviously, assistants for the doctor to communicate better or remind them to which patients to follow up with, or pre-defined messages to send them at certain stages. So there is lots of space for automation there, but we don't want to replace the doctor.
Right. And my closing tradition is using Professor Clayton Christensen's famous talk, How Will You Measure Your Life? And probably Clayton Christensen could be one of the close people to you as the father of disruptive innovation. Humanizing healthcare sounds like a very big mission, like almost a life mission. So Tomasz, when you look at what you do, what would be the way for you to measure your life? In other words, what is your definition of successful life?
Well, that's a powerful question. I actually had the privilege of meeting Professor Christensen when he wrote a book about transforming healthcare in Minneapolis. I was working there with my clients from 3M at the point, and we were at the conference. An amazing, humble person. Well, I think in general, I have a philosophy that it doesn't matter what I achieve, it matters what other can achieve thanks to me. and I guess I would just feel accomplished if I help build organizations, because that's the only thing I can do and know how to do, that impact other lives in positive way. Whether something will be built after Doctor.One, I cannot promise, because I have a little bit of this innovation ADHD and I keep thinking about what else can be built. So far, there is so much to be done within Doctor.One that I'm not thinking about anything, but maybe one day. So I think my impacting lives by building organizations that can live, even if I'm not working there anymore, is something that I really enjoy.
Thank you so much. That's a very beautiful life mission. We root for you. We root for Doctor.One. And honestly, I would love to have such a relationship with my doctor who could lead me and support me through the process. So hopefully next time we meet, there is going to be much more success stories to share.
Thank you very much.
Thank you, Tomek.